Welcome, and thank you for taking the time to attend this demonstration on meaningful use, how to achieve the core and menu measures. This video demonstration will cover core measure number 14, electronic exchange of clinical information. Let's get started. First, let's open the PDF of this core measure from the MTBC website. This is the Eligible Professional Meaningful Use Core Measure number 14, Electronic Exchange of Clinical Information. Here the objective is the capability to exchange key clinical information among providers of care and patient-authorized entities electronically. And this should include, or as an example, problem lists, medication lists, allergies, and diagnostic test results. The measure here that determines whether or not you achieve this requirement is to perform at least one test of the certified EHR technology's capacity to electronically exchange key clinical information. And there are no exclusions for this requirement. Let's scroll down a little bit and define some of these terms and see the attestation requirements. Diagnostic test results are very straightforward. Any lab tests that were ordered or results that came into the EMR. Different legal entities, so you would have to exchange clinical information with another entity. It cannot simply be that you have two locations for your practice and you want to exchange information between those two locations. It has to be a completely different legal entity. And the definition of certified EHR technology here is the ONC certified technology, the list of ONC certified EHRs that's available on the Chapel website, the Certified Health IT Product List that we saw on the Medicare website. Exchange here is defined as clinical information being transferred between these different legal entities using distinct EHRs. So for example, as an MTBC client, you may be interested in transferring the information to your local health information exchange that would then transmit the information to your specialist providers. Or as a specialist, perhaps you want to access the EHR notes from your referring physicians. That would be considered a transfer and an exchange of clinical information. And when we talk about distinct EHRs, those are distinct certified EHRs. It cannot be the exchange of information with another entity that does not use a certified EHR. And of course, patient-authorized entities, any individual or organization to which the patient has granted access to their clinical information. So whether it's an insurance company website, an entity facilitating health information exchange, so an HIE, or a personal health record vendor identified by the patient. So if your patient has an account on Microsoft's Health Vault, and the exchange of that information could be the submission of your EHR records to the patient's PHR. The MTBC PHR is linked into Google Health as well as Microsoft's Health Vault, and the patient has to affirmatively grant access and authorize these entities. But you can also meet this requirement through your local health information exchange. If you contact your local hospital, without a doubt, they're definitely already thinking about or have launched their own health information exchange, which is a local entity designed to aggregate health information from providers in the community who are using a certified EHR. This meaningful use measure is simply asking you to perform one test of that submission. And the attestation requirement here is a yes or no. Eligible providers must attest yes to having performed at least one test of a certified EHR technology's capacity to electronically exchange key clinical information during the reporting period. Now, there are some additional notes that they've provided down here that explain a little bit more about what these tests would include and how you can meet this requirement. So the test must involve the transfer of information. It cannot be a simulated transfer. It cannot be a theoretical transfer. You have to actually transfer some information. And the transmission of actual patient information is not required. So if you set up a test patient and you submit a CCD file to the local health information exchange, and that is a test patient, that would suffice. And the submission of that actual test patient is more than enough to meet this requirement. Additionally, you must use your clinical judgment to identify what information is considered key clinical information. But a minimum set is defined as a problem list, a medication list, medication allergies, and lab results. To meet this requirement, you must test the ability to exchange the clinical information at least once. So one test, either during your reporting period or even prior to your reporting period, is enough to meet this requirement. And finally, the most interesting line of all is that an unsuccessful test of electronic exchange of key clinical information will be considered valid for meeting the measure of this objective. So if you complete a test, but you find that the test is unsuccessful, if you attempt to submit information to the local health information exchange, but you are not successful during that submission, that is still considered a valid test for meeting this measure. So the simple way to achieve this measure is using the MTBC PHR and the submission of the patient health record to Microsoft's Health Vault or Google Health. Or you could simply call your local health information exchange. That might be a state-based health information exchange or a county-based health information exchange or a health information exchange with your local hospital and perform one test of submission. If that test fails, you've still met the requirement. So let's go ahead and take a look at how we can meet this requirement through the MTBC EMR and through the MTBC PHR. Let's begin with the EMR. Now, as we saw earlier, in the MTBC EMR, we have the ability to generate continuity of care documents. Those continuity of care documents are specific to a patient, and those continuity of care documents include such things as lab results, medications, allergies, and the like. Let's go ahead and click on this CCD button from the patient demographic screen. Here we have a continuity of care document for this patient. It includes her insurance providers, allergies, problem lists, medication list, vital signs, diagnostic test results, immunizations, procedures, and encounters. This file is actually stored on your local computer. Submitting it to a health information exchange would require the health information exchange to have a certified secure site where this information can be submitted. You will need to find this file on your local computer before submitting it to the health information exchange. Once you open up the path where this file is saved, submitting it to the Health Information Exchange will depend on the current setup of the Health Information Exchange. These files have been certified and approved as the required means with which to exchange clinical information. You can also meet the electronic exchange of clinical information requirement through the MTBC PHR. Let's take a look. Patients who create a PHR account on your website can exchange this clinical information with the PHR vendor of their choice. For example, in the MTBC PHR, your patients can select the option for PHR exchange and then click Export. Here, patients can choose to integrate their PHR with either Google Health or Microsoft's Health Vault. This external exchange of clinical information will meet the meaningful use requirement for the exchange of clinical information.